to talk about a piece of research that I was involved in late last year and early this year regarding trying to look at what the best evidence is around active travel and its promotion. So, first of all, and this does link back, I'm being FIF on, I can now link back to various other presentations. I'm looking for the drug link. It will come to me at some point in the presentation. But here's our MVPA, our moderate to vigorous physical activity profile for Scotland. You can see clearly, like other things, the age profile has a big influence on it. We can see the role of the domestic role in terms of physical activity. And arguably, of course, if we went back over a long period of time, the travel element would have been much bigger, but what's happened with mass motorisation is that we've substituted physically active modes of travel for sedentary modes of travel, which of course adds to the disease burden when people use those modes over long periods of time and then don't say, oh, I've stopped cycling or walking to work, I'll start swimming instead, because Homo sapiens don't do that. They don't do the substitution effect. So here's a profile. We know, therefore, that there are, in terms of all-cause mortality, the decline in physical activity across populations, and in Scotland, according to the official line, 2/3 of us are doing enough physical activity, i.e. we're doing 150 minutes at least moderate physical activity per week. I should give a plug now to the new Chief Medical Officer guidelines, which came out last week. Haven't really changed that much, but we are still falling short in terms of a third of the adult population are not achieving 150 minutes per week, which really exposes them to much bigger risks of all-cause mortality, particularly the cardiovascular risk as well. And we know that when we think about these, that they are socially patterned. So all the things that were said by previous speakers this morning about the profile of the population, yes, if you're poorer, you're probably likely to be doing less physical activity and have a higher risk as a result of that. But then let's just march onwards to what I'm really here to talk about this morning. So this was a review of the evidence, the link between active travel and physical activity. There's a brand name there beside Napier, which is Sustrans. Many of you who are at all interested or even involved in the active travel side or physical activity will know them well. They're a reasonably big player. Again, an NGO has come into play over the last few decades where government has failed to act. That's the way I describe the reasons for Sustrans' success in inverted commas. And we were asked by a client, which I'll tell you about in a few slides on, to investigate through an evidence review the links between active travel and physical activity. What sort of role does it play? So what is the potential and actual contribution of active travel to physical activity participation? And then we got these other questions: what interventions are effective in increasing active travel for physical activity? So, you know, in the detail now, what are those really, which are the most effective ones? Cost effectiveness, of course, comes into the equation. What data have we got about cost effectiveness? And what are the characteristics of the effectiveness and cost effective interventions? So again, drilling down into the detail where we have it. And of course, the question often is, do we actually have that research evidence in our libraries, so to speak? So, and then we come to one of the other key questions, which again has been touched on, is what types of interventions most benefit different subsections of the population. So when we think about what we call the dose response curve in physical activity, the people that do most are probably people that are fairly typical of those of us in this room. We do more than 150 minutes a week, and we received quite a lot of benefits as a result of it. But actually, if you look at the population profile, the people who aren't being physically active are the people in the lowest quintiles in terms of subpopulations. We needed to explore what the literature told us about that. So we cast the net wide, as we do with an evidence review. We set the bar high, and just to say what I mean by that is we only included studies where we had some sort of control or comparator. Everything else was thrown in the out bin, as it were, in an evidence review. We therefore came up with a lot of those, although I'd like to think these days we don't actually print them out. We just read them on our screen. We had a lot of studies which we considered, of course, and then we had about 70, excuse me, I don't remember the number which were finally accepted, and I haven't got a nice flow chart to tell you, to show you the process that was shown to you earlier with another review. But nonetheless, we did have about 70 studies which got over the bar. So what we actually found was we had 6 settings or typologies. So I'm just going to go through them for you. So we had the city and town-wide interventions. We had specific routes which were developed. We also have what we know quite a lot about in public health, the role, the importance of social marketing, getting the information out there to ensure that people have the information needed, and particularly the idea of social norming. Workplace and other institutions, the interpersonal interventions, which are particularly about personalised travel planning. So that might be where someone comes and knocks on your door and asks you if you want to have a conversation about it. It may come back again another time, but they'll ask you about your travel behaviour, and that may be of your family, and try to provide you with some cues and nudges and helps, maybe even a free bus ticket or something, to help you be able to perhaps break out of the habitual behaviour that you have, which is to jump in a car for short journeys particularly, and change that behaviour if they can. And then school-based interventions. Of course, we often deal with schools for various reasons, not least they are the next generation, and the greatest opportunity lies in the early years. So we had these different typologies and settings, and here are the numbers in terms of the find. So you can see, for example, I just need to explain this to people that don't get involved in the boring things of the detailed evidence reviews, etc., is that just because there were 35 studies looking at schools doesn't mean schools was the most important one. It's just because the little darlings in schools are captured and we get allowed in a lot more to do it, plus because of the worldwide literature, we're looking at the Federal Highways Agency in the US has done a big program over the last 10 years to promote safer routes to school, as they call them. And therefore, there's a lot of studies that have followed subsequently, and so that is the reason for the size. So don't be blinded by the numbers, because they don't necessarily tell us particularly more about something if they're repeating themselves, for example. So then you get in the detail, and whether at the back you can see this, I don't know, but this just tells us the direction of travel, if you like. So I'll just point out the first one. So city and town-wide interventions, there were 14 studies that looked only at cycling. There were 5 that looked at both, and the direction of travel. So there were none that were negative in terms of their outcome, and you could see the same for others. So I'll point out the workplace institutions and other institutions. There were 2 studies which had negative findings, and were 2 that were positive, so that's pretty ambiguous on that particular one. So the overall result of this, of all these studies, gave us a picture like this. So the key finding and a takeaway point for those of you interested in the active travel agenda is this thing in the centre. It is the most effective interventions appear to be town or city-wide approaches. So there's your take-home point. The detail of that, it is likely that these interventions have multiple interventions within them. So you might be building cycle lanes, you might be doing 20-mile-an-hour speed limits, you may be doing a range of other things, including those included in those 6 typologies. But the best bang for buck is if you can do whole town, city, community interventions rather than just relying on 1 or 2 things. We know, of course, from many public health interventions, if you only rest things on 1 intervention type and it doesn't really succeed, you're stuffed. So it's multiple interventions that appear to be the most successful. The next slide is a bit vague, and I do not expect you, to read the wording at the back of this. Is this part really of a systems mapping exercise? But it just shows you for cycling all the bits of the ingredients, and if you then think about the ingredients for walking, plus the other things that we would need, which would be perhaps, okay, I've mentioned speed limits, but it might include road pricing, it might include other, we talk about carrots and sticks, So there will be some sticks in there which need to happen if we're going to get to prize people out of motor cars, particularly for short journeys. And of course there lies the politics which we've been talking about earlier, the difficulty of doing this in a society which has been geared up to be the age of the motor vehicle. So here's an example. The giveaway now on the right is the slide which is the front of the report which came out in May, and the client was Sport England, which I think is particularly interesting. I want you to think of Sport Scotland. Just change that word, that's all you need to do. The important point there is that the client has got it. The penny has dropped. Sport is fine for those that participate in it, but we know that it's such a small subsection of the population. I used to be an athlete when I was young, so I've got nothing against sport. But if we're talking about population health, the answer lies in routine daily physical activities, of which travel is an obvious element, as I've already alluded to. The slide on the left is the front cover of a major study which should have got far more publicity than it's done so over recent years. This was a study of Darlington, Worcester and Peterborough, which were together given a measly sum of £10 million by the government in the mid-noughties from about 2004 to 2009, a 5-year programme to see what they could do as sustainable travel towns. So this was a really interesting piece of work, and this TRL report on the left-hand side was a post-end of project 5 years on, so it's really unusual. We've got a really rigorous study that took 5 years afterwards. It's got at least 4 years post-intervention data. So one of the things that it found was that overall in the 3 towns there was a reduction in total traffic levels of the order of 2%, which may seem small, but it was a very small budget. But we actually stopped the rise in traffic. Everywhere else it's going up in the control, because of course we had the control. Together a reduction in 7 to 10% in the number of car trips per resident. Now that to me is part of the thing that will help us, and what Fintan was alluding to in terms of the pollution issue, that is starting to turn the tide. The really sad thing is that government, subsequently to that, did not take this project which they had funded and say we need to roll it out around the rest of the UK, which is what it should have been done, because then you would get the synergies of that, I strongly suspect, in terms of longer change behaviour, transitions away from habitualisation around private car use. So there is, we argued, to our client Sport England, Scotland, that there is an overwhelming case for investing in active travel to support physical activity. Prioritise town and city-wide approaches, promote active travel synonymously with physical activity. Because in terms of the challenge of increasing population physical activity, this is such a potentially big slice of the pie. Consistent and long-term funding and cross-government support, I'll come back to that in a minute because that is really important and it's got politics written all over it. And then further research and evaluation, which of course is a default key on any researcher's keyboard. So the overall conclusions were that there is this strong evidence for positive impacts of interventions to increase active travel, that the evidence of positive impacts covers a number of intervention types, 6 typologies that we came up with. And that, of course, this takeaway point, it's the town, citywide interventions, the multiple interventions that are most likely to be most effective in changing travel behaviour in the way we need to have for transformative change. I don't think I've heard that phrase yet, but that is nothing less than that will do now. And Fintan alluded to the fact we can no longer deal with incrementalism. Incrementalism is in the bin. It's a 1950s idea from an American professor which has now had its day. We have to move much, much faster. So, prioritise these whole system type intervention approaches. Identify combinations that fit locally, because clearly we need to ensure that the degree of fit, the internal validity, as we say in the science, is strong, but we need to make sure that they fit the local circumstances. We need to engage and ensure that the local agencies, which are the higher authorities of local government, really take a strong lead on that. And historically, we've only had the brave few really moving forward on this. And I'd say possibly the Edinburghs and Glasgows, where we've got conveners who are really, of transport, who are really got it and know we've got to have transformative change. We need to have consistent long-term funding streams, and I just need to stop for a moment here and say something about that. So why is it in the age, on the ideologically driven age of the motor car, that we have a bottom line for road building, we have a bottom line for rail? We do not have a bottom line for sustainable transport, which includes buses, which might make the gentleman who asked the question earlier a bit happier that I've actually mentioned buses. That's the best I can do, I'm sorry. But we need a bottom line for sustainable transport so that we do not suffer the continued, what I call projectitis, which is you have a project which may last 3 or 4 or 5 years, like Sustainable Travel Towns lasted 5 years, but only 3 towns. And then it ends. And as it moves towards its end, of course, the staff on it, if they've not got secure jobs, will be looking for the next job, and then they'll leave. And we lose the knowledge, and we wait for the next generous minister to come along and say, oh, I'll decide we'll run a Healthy Towns programme or Sustainable Travel programme or whatever it happens to be. We need to end that. We need to have a permanent bottom line. And when we end the roads programme, as we will do, we will have a lot of money which can go back into health and social care, but we can have a few crumbs which, relative to what we've got now, will be a lot of money for the transport system for sustainable transport. And the reason for that particularly is doing the really good stuff I'm talking about here in terms of promoting active travel is actually very cheap relative to what we've been spending our money on, which is major programs for expanding road capacity so people can continue the habit of driving motor vehicles. So we need this consistent funding that has to be the bottom line, and it must happen very soon. And we need to ensure that these are integrated across the public policy streams, that we're connected across all areas, which is a wider fit really with the climate crisis issue. And of course we need to do proper evaluations. So few evaluations, even though we've got to about 65 or 70 studies in our review, which is quite a lot, so many studies fall by the wayside because they're not properly evaluated. They're evaluated for too short a period, and they do not have a comparator or control, which is just not acceptable. So there are gaps, of course. There are really important gaps, and societal groups that are missed out. So we know that when we start looking at these, that if I just click all those through, the small ticks are on I want to focus on here. So the cost effectiveness data is limited in the studies we have available. We do know from other research that cost-benefit analysis of active travel is really good. For every £1 you invest, you get at least £6 back, which is much better than many others, and road building generally doesn't even break even. So that's the politics in that funding stream. And we've got very little, by the way of studies, look at subpopulations. And this is really, it bugs me, because we really do need to know a lot more about subpopulation and how we can help more communities to choose and to be able to travel actively. And that could be just walking to the bus rather than necessarily getting on a bike. And the part of that is about the social marketing, it's about social norming, so you don't look a freak in your community if you actually bring out a bike instead of looking to own a car you can't really afford to run, and that's called forced car ownership, by the way. There was a literature about forced car ownership, which is big and real out there. Because of the power of social norming and marketing by the car companies. So, what are we going to? How is it intended that this review should be used? So we need to make it very clear that we have good evidence now that it is out there, that it needs to be acted upon. We need to be talking with government, we need to be talking with local authorities and other agencies to give them the confidence that there are certain intervention types that we really should be promoting, because also a word that I've not used is co-benefits. There are big co-benefits to have. If we get more people choosing to travel actively, including walking to the bus stop or to the rail station, etc., then we've got improvements in terms of air quality, we've got improvements obviously for the climate issues, we may have improvements, of course, in children's educational attainment. We know that children who are more physically active do better academically just because they've got oxygenated blood going through their brains. And we need to inform the planning system and structures about the importance of active travel, and that particularly around new homes and other areas. So these things are built in rather than having to be done retrospectively. I've had my 1 minute. I need to stop. Thank you very much for your time.